Between you and me, I love what I do. There is not a career that's probably better suited for me. After looking at different careers, I finally decided I really enjoyed helping people and I enjoyed biology. So I thought medicine was a good route. I went to medical school. It happened to be that I had the highest grade in my anatomy class my first year, and it should have dawned on me at that point, or dawned on somebody to tell me that I should think about surgery. My last rotation, my third year, right before we had to apply for residencies, I did general surgery and the light went on. I've always loved working with my hands, fixing things. My next rotation was plastic surgery, and on top of the technical aspect, it was very creative. And I couldn't believe the light could get brighter, but it did. And I was all smiles, and I just knew that I had found what it was I was meant to do. I applied for plastic surgery, was accepted, completed that, and then I went and did a facial fellowship and I did a breast fellowship, and I started my practice back in 1990, hitting the pavement running. I felt very lucky when I chose the field of plastic surgery that I realized I had a natural three-dimensional aesthetic sense. And then it was just my job to translate that into actual physical changes. The painter who painted this painting behind me obviously has a nice sense of three-dimensional aesthetics. If you look closely, a woman in a reclining position will pop out at you. And you'll see that this two-dimensional sculptor has a very good sense of three-dimensional aesthetic balance because he can sculpt all parts of the body equally well. Either you have that ability or you don't. I'm very happy that I have that because it allows me to achieve the results that you see, whether it be face, breast, or body.
Dr. Anton was chosen as one of Castle Connolly's top doctors. That's one of the top awards in the medical profession. He was peer nominated and then reviewed by the Castle Connolly Review Board. It is an honor and a lifetime achievement award that as few as 1% of all physicians in the country ever achieve.
I enjoy the creative process of plastic surgery immensely. I like creating new ideas, new inventions. For example, when I was with Dr. Hartranft doing the breast fellowship, we created together a new nipple reconstruction called the Star Flap, which was the first time just local tissue was used and a skin graft was no longer needed.
Our patients really love the fact that Dr. Anton gives back. And he does it for himself. He doesn't do it to look like a good guy. He does it because it's really important for him to give back. And I have to say, I think the happiest we ever see him is from his pictures of Operation Smile missions. He really loves connecting to the people. And even though it's long, grueling hours, sometimes 15 hours in the OR, he gets energized by it because Dr. Anton truly does enjoy helping people.